Hello everyone, welcome to my nursing educational channel. If you are a student, staff nurse or preparing for exam, this video will be going to very useful and support for your learning process. So what is today's topic that we are going to learn today? Today's topic is vitals normal values. And what are the vitals? Blood pressure, temperature, pulse rate, respiration and oxygen saturation. So we are going to learn today these vitals normal values. What is vital signs? Vital signs are important measurement that shows how the body is working. So why we check for vital signs? We check for vital signs to detect the illness early and monitor the patient condition. So what is BP? BP shows force of blood in arteries, or we can say pressure against the wall of the arteries. So what is the normal value of blood pressure in adult? 120 by 80 mmHg. So high BP equal to hypertension, low BP equal to hypotension. When the BP is high, in medical terms, we say hypertension, and when the BP is low, in medical terms, we say hypotension. So measured using sphygmomanometer. What is sphygmomanometer? Sphygmomanometer is a equipment to check the blood pressure. So next, what is pulse rate? Pulse shows heart rate. What is the normal value of pulse rate or heartbeat? 16 to 100 beats per minute is the normal value for adult. So check pulse at wrist or radial artery, neck or carotid artery. Mostly in radial artery and carotid artery we used to check for pulse rate or heart rate to observe rate, rhythm and strength. So next, temperature. So what is temperature? Temperature shows body heat level. So what is the normal value of temperature in adult? 36.5 degrees Celsius to 37.5 degrees Celsius. When the temperature is high, in medical terms we say fever, and when the temperature is low, in medical terms we say hypothermia. So what is the common site for to check the temperature? Mouth is the common site to check the temperature. Next, what is respiration? Respiration means breathing rate. What is the normal value of breathing rate or respiration in adult? 12 to 20 breaths per minute is the normal value. To observe depth of the breathing rate or respiration in adult and rhythm and effort. Fast breathing equal to tachypnea. When we take fast breathing, that time we say in medical terms tachypnea, and when we breathe slowly, in medical terms we say bradypnea. Next, what is oxygen saturation? Oxygen saturation shows oxygen level in blood. What is the normal value of oxygen saturation in adult? 95% to 100% is the normal value in adult. Measured using pulse oximeter. What is pulse oximeter? Pulse oximeter is used for to check the oxygen level in blood or oxygen saturation. Low oxygen can cause breathing problem. Okay, when the low oxygen can cause breathing problem and breathing difficulty, when the oxygen saturation is below 95%. Thank you for watching this nursing educational video. I hope this helped you learn something useful. Stay healthy, keep learning. See you with next video.